Okay, that's moving off.
This is going to be a train wreck.
Hello, ladies and gentlemen. You are listening to The Local Lens, a podcast from the Powell County Health Department where we go inside our community's experience with the drug epidemic. Our show is coming to you from Stanton, Kentucky, a small town nestled at the foothills of Appalachia. And very basically, our goal with this show is to tell each other stories as they relate to the opiate and drug crisis that has been affecting our community and many other communities like ours for decades now. And today's episode is a very important chapter in telling our collective story in this issue. I'm joined in this episode by Miss Jazmen Thorpe, who is one of the most resilient and tough people I've ever had the pleasure of meeting. She's one of many who has grown up with a parent in addiction, but rather than letting that stop her, she's used it almost as inspiration to keep going forward. Well, we'll let her tell her own story with it. We'll get into it in a minute. This is The Local Lens. I'm your host, Nate Brooks. This is a Powell County Cares project from the Powell County Health Department. These are our people using our voices, telling our stories, because no one sees it like we do. All right, let's get in the show.
Hello, my name is Jazmen Thorpe. I am a lifelong resident of Powell County, and I've worked in the community in different ways. I was part of the 4-H for a long time, and I've worked at the clinic here in Powell County, and I pretty much put my roots down here, and I'm ready to see things change.
Yeah, and you're not much older than me. How old are you now?
I am 29.
29, yeah, still in the 20s.
Yeah, still holding on.
Yeah, and you said you just started going back to nursing school?
Yep.
Yeah, congratulations.
I'm in nursing school.
Your younger sister, I was in school with your younger sister, and so we've been around each other for most of our lives. So you're from Powell County.
I am.
What have you seen the opioid crisis to be like?
Astronomical.
Mm-hmm.
It's sad for such a small community to be hit so hard,
Mm-hmm.
and I've watched it grow from I don't know if it's because I'm older and I see more or what, but I've seen it from when I was younger to now, and it just doesn't stop.
Mm-hmm.
It continues to be. I'm sorry, an unstoppable force. It's like we keep throwing things at it, and it keeps growing.
It keeps growing even.
Yeah.
That's one thing I've seen, like, as I've gotten older, is like it's doing the opposite of going away.
Yeah.
It's seeping into more and more that we see, and it's definitely got like its thumb like on our necks. It feels like
Yes.
it feels awful. So you have a pretty personal connection to seeing what this whole problem can do with people.
I do. I guess my whole life was kind of built around an addiction. My mother was an addict, and she fought it pretty hard when she wanted to,
Was your mom around with addiction like from the time you were little?
Yeah, I mean, from as far as I can tell, my grandmother raised me for most of my life.
Okay.
I can always remember staying in her house,
Mm-hmm.
So I assume that when I was smaller, even like infant,
Mm-hmm.
that it was an issue. So like I said, my grandma raised me. My mom came in and out, and I never really knew why.
Mm-hmm.
That was normal. I didn't know any different.
Mm-hmm.
When I got older, I was like 7 when my sister was born. And I started realizing that, she was doing the same thing, just kind of in and out. And I guess one day my grandma just told me, hey, your mom likes drugs. It is what it is.
You remember how old you were then?
I was probably 9 or 10,
Mm-hmm.
which was totally inappropriate.
Mm-hmm.
But she had probably had a really bad day, and that was the result of it.
Yeah. How would you have rather that conversation have gone?
I think there was a better way to,
Yeah.
like, at 9 or 10, I was probably in dare
Yeah.
You know, we probably had these talks, and there was a better way to deliver that information to a child. Because at that point it was like, oh, she likes drugs but not me. You know, that's weird. I think there's a much better way to educate people about addiction than just being like, hey, they like drugs better than their kids. Because that's not true.
Yeah.
My mom loved us. You know, I'm a mother. You can't look at your child and not just be in love. Addiction is it's a bear, you know, and it is a disease. It's a disease that medically we don't know much about, you know. It's a choice, but it turns into a disease. I mean, they chose to do it. But I think everyone has, like you and I even, there's probably things that we're addicted to that we don't know, like Facebook. You know, it's someone just chose the wrong thing to be addicted to.
And I think you made an important distinction, too, that I've not heard anybody say yet, that, like, the medical field doesn't really know much about addiction.
No.
Like, I mean, so, like, you'll talk to lots of professionals, and everyone will be like, we're figuring it out, like, we're laying it all out there. But then it's such a huge thing that, like, how can you even get to the bottom
Well, there's
of
just
it?
so much about the brain that we don't know, you know. And I think everyone's brain responds differently to things. And that's hard for any profession to nail down.
Yeah.
You know, because it's so different in every case.
Yeah. So, with your mom, too, how often would she be around? Like, when you were little, and then, like, once you started, like, being able to remember more?
I mean, it was just so in and out. She drove a truck across country. Not many women do that. She was so smart and talented, and she could do things that, you know, it just blew my mind to think about. But she drove a truck, and she was gone a lot doing that.
Was she a Grateful Dead fan?
Probably.
Yeah,
I mean,
she just listening to truck.
I can just remember REO Speedwagon a lot.
Oh, yeah.
You know,
yeah. I mean, that's also appropriate.
Yeah.
Yeah.
So, there was a lot of tapes. A lot of tapes. I miss tapes. So she drove a truck, and she was gone, you know, and I always just chalked it up to being gone to work, and, you know, moms go to work. But, you know, obviously there was way more to it than that. She got married a few times. I mean, it was just like, sometimes it was a week that she was home, sometimes it was a month. Like the longest stint, she actually got cancer when I was in high school. She got cervical cancer. And she was sober for about 5 years. She did great. You know, she was like the best mom ever. She, you know, that's how I know she loved us. Because there were times that, like, you know, there's just no way. But her surgery resulted in, or her cancer resulted in some complications with her intestines and things that caused her to be in chronic pain all the time. Which fell her right back into the rabbit hole of addiction. There was no way to function without pain medicine, and there was no way to have pain medicine without, you know, waking the beast of addiction. And I'm afraid that it's like that for a lot of people, and I don't know the answer to that, but it's something we should be working on.
So I actually remember from being in school with Jazmen's sister when this was going on. And we were elementary schoolers, maybe middle school when it was happening. We didn't understand. We were just young.
My sister and my mom have such a better relationship than me and my mom did.
How come?
I think because I was older, and I kind of just sheltered her from the bad. I didn't want her to know the bad, you know.
Yeah.
I didn't want her to, because I had really, really hard feelings for a very long time. Towards her. I just didn't, you know, there was just nothing she could do that made me like her. My sister, you know, she thought she hung the moon, and I just wanted to keep that innocence as long as I could, and I mean, I succeeded. She still doesn't see any bad in it, and that's fine, you know. That's I wish I had that experience.
How do you think that influenced, like, you as a teenager, seeing that close firsthand?
Well, it definitely kept me from trying anything too crazy as a teenager. I always knew, I just had it in my head that my dad was an alcoholic. I haven't ever mentioned that, but my dad was an alcoholic. And my mom was a drug addict. So I had it in my head that, if I try something, I'm probably going to like it and not ever stop. So I just didn't. So I think that's helpful. Just using that as a stepping stone. It also, seeing someone throw away so much potential really lights a fire to not do that. And you just want to, it just gave me the motivation I needed to push myself to be anything more than, what I grew up around.
What happens with a lot of people too, though, is if they grow up in that kind of environment, then they'll fall into the same patterns a lot of times. What do you think the difference was for you?
I think, honestly, I don't think it was a difference for me. I think it's a red pill, blue pill situation.
Okay.
I think that either you grow up and you're just accustomed to it and the cycle spins, and you grow up, or you grow up and you hate it and you want to break the circle. I just think that's a person by person situation also.
Was it going through school, was it known by your peers kind of what your situation was at all?
I don't know. If it was, they never acted like they knew, or they knew my grandparents raised me. I'm sure in my high school years that I was snide about it and probably said mean things, and but I got very lucky because I had two very wonderful grandparents that raised me to be. I think that had a lot to do with the motivation and inspiration to push me a little harder too. They raised me to have the right work ethic, and they knew right from wrong, and so I knew right from wrong, and they've been through so much. They really had. They lost both of their children. My mom and my uncle died in the same year.
Really?
3 months apart.
Oh.
It's just wild. The things that they've been through. Just, and they lived it as a parent with a child that was an addict, so.
Do you know what age your mom started using?
Probably 18.
Yeah.
I don't know. My grandma told me a story once that she ran away when she was 16. So I assume she was probably not doing great things then. I would like to think, she waited a little bit, but I do remember that story. She stole a car and drove to Georgia. Of all places.
Of all places, Georgia.
I wonder why.
Was it Atlanta, or was it just?
I think we had family living there or something,
okay.
And she just went there.
Yeah.
But she's just, I don't know, they raised me, so I know they did a good job. So I don't know. I don't know what brings it out in people. I really think some people are just wired that way. To do risky things and.
So, let me ask you this then. So, when you were going through school, I think that has to be happening a lot for a lot of kids. How many kids that you graduated with do you think were in similar situations?
I can't give you a number.
Yeah.
I probably plenty.
Yeah.
That had worse situations than me.
Yeah.
That didn't have people taking care of them.
Yeah.
That didn't have a good support system. That, I remember there was a time when my sister was first born, so my mom was on an up. So we lived there's a house on a hill and then there's a trailer below it, and we lived in that trailer with my mom. And I was probably 8, she was about 1, and I would get up every morning, change her diaper, give her a bottle, and put her back in her playpen and get on the bus and go to school before my mom even woke up. And I remember thinking back on that in high school and wondering how many kids had to do that every day of their life forever. Thankfully my grandmother took us back home, which is that's my home.
Mm-hmm.
But I just can't imagine trying to grow and learn and develop and having all that other responsibility all the time.
Yeah.
Like, cards are stacked against you at that point.
Yeah. Was the school offering anything to help, really?
I don't really think the school knew. I mean, I was 8. I didn't tell.
Well, that's, yeah. Yeah.
Nobody really knew that I was doing what I was doing.
Yeah.
But it didn't last long, like I said. I mean,
yeah.
Yeah.
So you've been working in the medical field
Mm-hmm.
for a few years, and you're going back into nursing school.
Mm-hmm.
Did your whole upbringing, did that push you down this medical field, or?
I think my whole life experience turned me into a person that is pretty selfless.
Okay.
I've seen a lot of selfish actions my whole life, and I always wanted to be a person that never put myself first.
Mm-hmm.
I mean, in a healthy way.
Mm-hmm.
I want to take care of people. I want to help people. I assistant coach the high school volleyball team.
Nice.
I put myself in any situation I can to help people.
Yeah.
And I really think that, my childhood experience formed that need to help others.
Yeah. That's pretty good. Do you see yourself as a person with much empathy towards, like, the whole addiction community?
In my older, I say older, like
yeah.
I'm old. In my older
not
years,
high
yes.
School self. Yeah.
in my young adult years, yes.
Yeah.
In my teen and like early 20s, no. I've completely turned over a different leaf from then. But then I hated the world.
Mm-hmm.
I was a new mom that had this kid that I loved so much and couldn't understand how a parent could ever turn their back on their child.
Mm-hmm.
And I was bitter about it, but, a few years and a lot of therapy later, that's a big key, therapy.
Mm-hmm.
I'm pro therapy for anybody that has been through anything.
Yeah.
Anything.
Yeah.
I have turned a different leaf. I see people who are helpless. I see people who have got themselves in a situation that they can't overcome.
Mm-hmm.
No, some people, no matter how hard they try, I see people struggle every day. Janelle's doing great work.
Mm-hmm.
The Casey Law advocacy is great here.
Mm-hmm.
I have a cousin that got Casey Law a couple weeks ago. She's not going to do well. She doesn't want to be better.
At first at least, but it's a long road.
Yeah, well,
road.
I mean,
yeah.
she's not gonna take it well.
Yeah.
She doesn't want it.
Yeah.
But that's why there's a Casey's Law.
Yeah.
To show you how you do want this.
So, what do you think was there a specific event that you remember that, like, really changed your perspective on it from, like, the bitterness towards it to more empathy towards it?
Probably when my mom died.
Mm-hmm.
Because when she died, I felt really relieved. Like, I don't have to worry about her anymore.
Mm-hmm.
And I thought, oh my gosh, that is such a terrible thought to have.
Mm-hmm.
Like, I felt good because my mom died. And so that's when I started going to therapy, because I was like, I'm not a monster. I swear
Mm-hmm.
I'm not, but, that was a true feeling that I had. And I was relieved. I didn't, deep down when I went to therapy, I realized I was, because I didn't have to worry about her, because what I didn't realize was for the whole 23 years that I was alive, I was always worried about where she was and if she was still alive, Then that opened my eyes to how helpless she probably was, And that's sad. It's... I try to tell people not to be bitter about it, but it's hard. I mean, I know I was hard on my mom, and I know I was, and I probably made her situation worse.
Mm-hmm.
I don't carry that with me because, you can't change anything that happened already. But I try to tell other people, like, hey, slow down and see. Slow down and think about how you can help them.
Mm-hmm.
overcome what they're struggling with instead of belittling them for struggling.
Mm-hmm. That's something I hear a lot, like, doing these episodes, is, like, ask yourself, like, are you helping or are you hurting, like, the situation? And, like, I think that's a good rule of thumb for pretty much anything you're ever going to do. Like, why on earth would you knowingly do something that hurts?
Well, see, that's why I had such a big conflict, because I built this life on being this selfless, caring person, and here I was doing the exact opposite. But it was far too late for me to make amends there, so now I just do what I can for everyone else, you know.
Yeah. How long were you in therapy for that? Or are you still doing it?
No, I was in therapy for about a year.
Okay.
School and work and time kind of makes therapy hard.
Because raising a child.
Oh, yeah. That also. That likes to play all the sports.
Yeah, good. What sports does he play?
He plays basketball and soccer, but there's 2 soccer seasons a year.
Good.
You know, so we do. He does upward and little league. Yeah. So really 4.
Yeah, year round then.
Yeah. He doesn't like baseball yet, so we'll see.
I don't blame him. Baseball,
it was boring to him, so.
Yeah. They make you wear. It's the hottest time of year, and they put the tightest pants on you and big socks and
a hat. And
go stand in the sun and just wait for a ball to come your way. And I was like, that's not very fun. And I was scared of the ball. I was bad at baseball. Baseball wasn't fun for me. So I don't blame him if he never comes around to it. But soccer's really fun.
Oh, he loves soccer.
Oh man, you're just running around. That's awesome. It's so fun.
It's the best.
He's
always tired.
I can't imagine like another way for a kid to get out all their energy. Like that has to make it easier on you at home. Just like that's genius. I'm gonna really push soccer in my household someday.
It's a great idea.
Yeah. Well, that was way off topic. We hit on this a little bit earlier. You said addiction is definitely a disease that comes about by a choice, is how you put it, I think. Do you want to expand on that at all?
Well, I think that what people don't understand when they want to argue about choice versus, disease is that we make choices every day. A million times a day you make a choice. What you're going to put on, what you're going to eat, what you're going to watch on TV. And I think I touched on it and I said that, we all have addictions.
Yeah.
Every time we open that app or every time we turn on that TV show that we binge watch, you're feeding an addiction. The only difference is that these drugs that people are taking alter their brain to make them think that they need it or they can't survive. Yeah. It's like, for example, I watch Grey's Anatomy. I'm a really big Grey's Anatomy fan.
Sure you're not alone there.
I know I'm not. I have a Grey's Anatomy group chat,
that's great.
And the COVID made Grey's stop airing this season. We didn't get to see the season finale.
Really?
Talk about a lot of mad stay-at-home moms.
Yeah.
I mean, a lot.
Yeah.
We were upset.
Yeah.
So is that addict that can't get their next hit. It's literally the same thing. It's just one's more dangerous than the other. Grace can't kill me.
Yeah. And then one thing that's happened too with COVID, that if you've heard any of these other episodes, you've heard this already, but the COVID put everyone in isolation too. Right. So people in recovery.
Talk about mental health.
Yeah. Talk about mental health.
Sad. I'm a very big advocate for mental health.
Good, thank you.
I think mental health really almost controls our physical health. I mean,
No, I
really do.
With you.
I mean, if I'm in a depressed state, my whole body hurts.
Yeah.
I don't want to move.
Yeah.
I don't feel like getting up and cleaning the house, you know. If I'm an addict, I'm always depressed because I don't like myself.
And then you add in all of the other biological factors and the chemical changes that are going on in your brain. And if you want to learn more about specifically the brain chemistry and the biological changes, then you can check out a couple of our past episodes with Dr. Cassis or with April Smith and Lisa Coffey. Those are great resources for learning about this stuff. But for right now, just understand that it is a much trickier problem to solve than it looks like on the surface.
I can't imagine waking up every day and fighting that fight. And then going into a time where I can't go out and have a meeting where I can talk to people that make me feel better. Or where I can't go to therapy. I have to talk to someone over the phone. You know, I mean, that's something, but it's not the same.
It's not the same. It's not the same. Like, we're social creatures.
It's not easy. It's not an easy time, but, you know, just like everyone is saying, we do have to do this together. We have to check on our neighbors. We have to care about other people to get through what we're going through together. And the war of addiction is the same. You know, it's a pandemic that's been going on for as long as I can remember.
Years, decades, yeah. With the community, you're coming from a place where you made it through seeing somebody close to you fight this their whole life. You were one of the people there that, like, you were pulling your sister through. And by God's grace, you had a grandma and grandpa that were pulling you through. And looking to other families that are struggling with the same struggles, what could you say to them that would maybe help them?
Number one, without God, you don't get through it. And I don't know if you want to go down that road, but that's the only way you get through it.
Let's go down that road.
There are nights that I remember laying in bed knowing that the only person that I had on my side was God. But it got me through to the next day. You know, there are nights that I prayed that my grandma wouldn't hurt the next day. Just give her a day that she doesn't get hurt. You know, give her a day where her soul can rest. That's the strongest recommendation I can give anybody, is to trust in God, because He will move. He will give you a way through. Reach out to other people. Find other people. Don't be embarrassed by what cards you've been dealt. You know, find other people in your situation. Lean on each other. Find resources. Do what you have to do. Don't let it overcome you. Because then you're in the same boat. You know, and that's not where you want to be.
Yeah.
Nobody wants to feel alone.
Yeah.
But that's why I stress the whole, you know, have God on your side, because then you never feel alone. And that's important.
Yeah.
Well, that's just about all the time that we have for today's episode. Thank you guys for listening to the episode. Thank you for paying attention to Jazmen. Reach out to her if you can. Give her some praise for being on the show with us. It takes a lot of bravery and courage to come onto this show and talk about this stuff as honestly as she has. So I will give the biggest possible thanks to Miss Jazmen Thorpe for everything she's done for this so far. I would also like to thank WSKV for broadcasting the show, and the Powell County Health Department for letting the show become a thing, and for Kentucky Rio for further sponsoring the show. This is The Local Lens, a Powell County Cares project. I'm your host, Nate Brooks. Thank you guys for tuning in. These are our people, using our voices, telling our stories, because no one sees it like we do.